Hi, Maryanne. How are you?
Fine, Greg. How are you?
I'm great. Thanks for joining me. I'm really looking forward to your lecture in Delhi, which is titled, What Do We Know About Scarring Alopecia? Most hair transplant surgeons are going to know a little bit about frontal fibrosing alopecia, lichen planopilaris, CA. And I'm sure you're going to talk about these, but are you going to be telling us about other types of scarring alopecias?
Yeah. So, first, Greg, I want to thank you. It's really an honor. I'm really excited to be attending this meeting and especially visiting India for the first time. So, thank you for the kind invitation. When we see full blown CCCA, LPP, FFA, right, full blown scarring alopecias, we can identify those, recognize those, and counsel patients accordingly who are looking into scalp hair transplantation or other procedures. But increasingly, we're seeing very subtle presentations of scarring alopecias, many that can mimic non scarring alopecias, including male and female pattern hair thinning. And so, what I am planning to do for my talk is to hopefully impart clinical pearls that hair transplant surgeons and physicians can take back to their clinic right away and start implementing to avoid any misdiagnoses or other issues that could impact the quality of the work that they do.
Yeah, and so I know you've kind of said it, but just to spell it out, why is it important for hair transplant surgeons to know about scarring alopecias and how to recognize them?
Yeah, so I mean, there's absolutely nothing worse, right, than um, having a bad patient outcome after we have our the best intentions and we do our best work. There's nothing more disappointing or more of a letdown, right? Both for us and for our patients. And so my goal in trying to impart these clinical pearls and help surgeons and docs recognize subtle cases especially is so that you can prevent any missteps and provide your patients with the best possible outcomes because we know that it's more or less accepted that we want to avoid doing transplantations, especially in patients with scarring alopecia. And so being able to identify these is really critical.
Yeah, maybe not avoid, but certainly have a detailed discussion with the patient. I
Exactly.
just recently did a transplant an older lady with a large area of almost total hair loss, which was diagnosed as lichen planopilaris. But she went in fully understanding that it may not work, it may work temporarily. And of course, we do see patients who do look like they've got typical male or female pattern hair loss, but then there can be, as you say, subtle signs of a coexisting scarring alopecia that may have an impact on their results. So I'm really looking forward to hearing your talk. And I know that you will be co-hosting one of the discussion tables on trichoscopy as well. So we look forward to seeing you in India.
Yeah, thank you so much.